After placing the goggles and securing the wires to the patient, you can begin the VHIT test. There are two hand positions used during the VHIT test. The first test is the lateral test, where you set your hands on the patient's jaw underneath the wires. Place the index finger and the middle finger above and below the jaw. Once you have secured your hands on the mandible, ask the patient to slightly clench their jaw. It is important not to use your hands to secure the mask strap or the goggles against the head, otherwise the results will be skewed. Have the patient stare at the fixation target directly ahead. The test begins with thrusting the head from left to right. You can also thrust the head in the same direction, say for instance at 10 degrees right and then 15 degrees right as shown in the video. With the vertical canals, the hand placement is different. Place your hands on top of the patient's head without touching any part of the goggle. In the right anterior left posterior test, or RALP, the patient continues to stare at the target straight ahead. Then you turn the patient's head 30 degrees to the left. You will notice there is an indicator on top of the goggles labeled RALP with an arrow. The arrow indicates the direction of thrust, and that should be toward 0, which is the patient's midline. For left anterior, right posterior, or LARP, the head is turned to the right. Again, placing your hands on the patient's head, and this time turning their head to the right with the arrow pointing toward midline of the patient, or 0 degrees. Thrust the head in a down and upward motion. If you have any questions, please contact the Micromedical and ask for clinical support.